Hey legends, I'm Eliza Lee and you're listening to The Making of an Incredible MD, the podcast for aspiring medical professionals. Last season, we geared you up with a ton of different topics and ethical dilemmas to think about in the medical field. And on this season of the podcast, we're taking you behind the scenes of live MMI Mock Stations that we run for our students who are about to sit their med interviews. So stay tuned for a new station each week and hear a handful of our future med students give it a good old crack. Today on Station 2, we have one of our University of Melbourne examiners and Section 3 GAMSAT tutors here at Halad, Keeley, interviewing one of our aspiring med students, Anastasia. Before we hit record, we give each student 3 minutes to read the station and then they have 8 minutes to respond. And today, the station that Anastasia read was this. You are a third-year medical student and are on rotation with another medical student, resident and staff physician, Dr. Kerry. During rounds, Dr. Kerry and the resident make several demeaning comments to the nurses on the team. Afterward, the conversation continues in the doctor's lounge. Several condescending comments were said by Dr. Kerry and the resident about the patient management suggestions made by the nursing staff. You are bothered by the comments, but also know that Dr. Kerry and the resident will be doing your evaluation at the end of the rotation. Other medical students tell you that you'll get a better evaluation if you just fit in. That's definitely a hard one, and now over to the recording.
Okay, so first question here is, you decide that it is necessary to speak to Dr. Kerry about the situation. What will you say?
Yeah, I think this is a really tricky situation for a third-year medical student to be in. But I think I would approach it more from a trying to gain more knowledge and understanding sort of standpoint, because you are there to learn, and part of that learning is also learning how the doctors do interact with the nurses and the relationship that is there, and typically that should be quite a constructive one. So I think I would ask him about what the relationship usually is with the nurses and how they communicate usually, and sort of reciprocate advice of each other in terms of making sure the patient outcomes are the best they can be. And I think if he continues with the sort of demeaning comments like, oh, our nurses here are useless or whatever he's saying about them, I think I'd be like, oh, what do you not find helpful about them? So I think I would kind of just question his reasoning as to like why he is actually making those demeaning comments more than anything. Yeah.
In this case, how important is it for you to speak to the staff physician? Rank it on a scale from 1 to 10.
I actually think it's quite important. I think I would probably rate it like a 7.5, mainly because I do think it is very important to learn the relationship you have with the nurses. Try to gauge why his actions were like that, because I think it's really important in a medical setting to have a really constructive relationship with the people you're working with, whether they're nurses or doctors. And that's all part of the learning, not just the medical stuff, but also those interactions. So I think it's quite important to talk to him about it.
What are the risks and or long-term implications of your decision to speak to Dr. Kerry?
So I guess the main risks are the fact that you feel like you might not get a good evaluation, because he could think or judge you based off your confrontation with him. And I think that's the main thing that is raised as an issue here, is that fear of the evaluation not being good. But I think at the end of the day, you need to weigh that up with what you want to get out of the experience as well. I think someone can evaluate you quite easily just like that. But you also, I think it comes down to a bit of self-evaluation. What do you think of yourself if you don't try to understand this as well? And are you getting the most out of this experience if you aren't looking at maybe the flaws in the system as well? So I think, the main risks are probably your fear of that evaluation being bad. And I'm not sure what the repercussions would be in terms of an overall outcome in your, like, I don't know what the weighting would be on that in terms of your outcome in marks and stuff. So I guess that would have to be considered as well. But I think overall you'd need to think about how much you value that over other things, and you might actually gain more respect out of questioning and confronting him about these things and trying to understand it. So it actually may have a positive impact as well.
How does your decision contribute to your overall professional development?
Yeah, so as I've sort of repeatedly mentioned, I think it's really important in a medical setting to learn when you're on rotation and all of that, not only the medical knowledge that you're gaining from the doctors, but also the interactions, how they communicate with the nurses and other staff, because that's all part of producing effective outcomes for patients, is working well in a team. And so I think understanding the logic behind the demeaning behavior, I think clarifying to yourself that that's not appropriate based on maybe your discussions with that doctor is really important, because you don't want to become a demeaning doctor yourself. So I think questioning it and confronting the issue is quite important.
Is there anything else you would like to add?
No, besides for the fact, I guess, that I think it's really easy. I can imagine it would be very easy as a student to feel a lot of doubt in your actions when you have people above you. But I think it's really important to keep headstrong about a moral compass throughout all of that, and realize that just because they're above you, it doesn't mean that they're necessarily morally superior all the time. And I think being true to yourself and your values is really important throughout that whole process.
Excellent. Thank you so much for that, Anastasia.
Well done, Anastasia, for giving that a good crack. And now over to Keeley for the feedback.
Okay, so timing wasn't too bad. So that was about 6 minutes there. Do you have any opinions, or what did you think you did well with your situation there?
I might have babbled on a bit off topic with a few of the questions. I think when you asked about the risks involved, I went a bit off topic. So I think that's probably an area I could have been a bit more concise. But yeah, I'm not too sure. I think overall I was okay with it. I wasn't super happy, but yeah, I'm not sure.
All right. Okay, so first of all, so obviously here we're looking at a bit of a problem solving, maybe a little bit of ethics in there, considering about the impacts on yourself, but definitely a problem solving based station here, where you've been put in a situation that's a little bit uncomfortable. I think everyone would recognize that. It's not going to be an everyday situation that people are generally used to, particularly being, as a medical student dealing with someone superior, kind of being challenged to speak up about something or some of their actions there. So it's a really important one. At most medical interviews, you'll get some kind of station like this, looking at, sometimes it might be in the preface of teamwork, working together, having a difficult teammate, or some kind of other situation where they want to see how you work through the situation and kind of come up with a bit of a appropriate response. So overall, I think your communication was awesome in that you were very clear and you're quite articulate. I could get every point that you're coming across. You didn't mumble at all. I know it's through Zoom, so it's a little bit difficult to actually tell, but you can tell you had very appropriate body posture and you were engaged in providing that feedback and making sure you're expressing your opinions to the best you could. So it was really good. So that came across even through Zoom, which is amazing because it's a bit different from being online. And overall, what you said as well, you kind of stuck to your guns a little bit there. So you knew what your overall response was going to be, and you didn't go back on yourself at all, which is really good because you don't want to be contradicting. That's the word. Don't want to be contradicting yourself as you go to further questions or feel like you're unsure of an answer, because at the end of the day, you can evaluate both sides. In fact, it's quite a good thing to, evaluate, speaking up, this could be really, really good. This could also be the negatives of it. Overall, though, they kind of want you to come to some kind of decision. Is it worthwhile? Is this going to be the best response? So I'm just going to go through some of the questions and we're going to have just discuss a little bit about them. So for the first question, I really liked how you kind of framed your answer to this question of being about acknowledging the fact that you want to learn from this doctor, not just the medical knowledge, but you want to learn about the environments and the interactions between all the staff, particularly in this case being between the doctor, the head physician, resident, and the nurse, and kind of focusing it on learning about the interactions there and kind of understanding the reasoning behind there. I thought that was really good because I suppose that's not an aspect that everyone will necessarily consider. I suppose my kind of advice for this station was, I think you might maybe elaborate a little bit further or explore a little bit more on the other aspects of it. So when you speak to the doctor, are you going to say something along the lines of, I heard this going on and I don't think it's appropriate to speak behind the nurse's back? Also consider the implications for the nurse themselves. So obviously they're not in the room and not in the place, and obviously it's not your job to speak on their behalf or anything, but consider what the effects of these actions are. And is that something that you should be raising with the doctor, or maybe alerting them to, reminding them is probably a better way, just reminding them that, this is a workplace, isn't appropriate, position to be talking about someone behind their back. They might have really legitimate feedback, and within hospitals we do have a very hierarchical system where we're constantly getting feedback to help improve our skills and help with improving that patient experience, making sure that we can provide the best care and patient management. So it might be a matter of, rather than the doctor talking behind the nurse's back about and saying these condescending comments about whatever the suggested patient treatment was that they didn't think was quite appropriate, maybe it's a matter of suggesting to them that they speak with the unit manager, the nurse in charge, or even just have an informal discussion with the nurse themselves, so that we can try and, not just take away how we can learn the environment that already exists, but also make sure that by not saying anything about an inappropriate response, that you're not enabling it to propagate. Obviously, as a medical student, you don't want to overstep too much. It's not your role to, dictate the whole environment there. But as someone who will be then moving into the medical system and working in this kind of environment, it's kind of, you don't want to be blind and allow this kind of culture to continue, because you could be the one having people speaking behind your back in the future. So being comfortable enough to say that, and not everyone is comfortable, it's not always appropriate, but maybe it's just a matter of saying, hey, rather than telling the doctor what to do, saying, hey, I don't feel comfortable with, hearing you talk badly about the nurse behind their back. Like, that would be a way of saying, yeah, I don't agree with this isn't quite right, but also, not overstepping your position as a medical student.
Yeah, okay. Yeah, that's good advice. Thank you.
So for your second option here, rank how important is it to speak to the physician staff? On a scale of 1 to 10, you ranked it about 7.5. So you're very decisive there. You definitely obviously have an opinion. You've thought about it. The only thing I would probably say with regards to this is to kind of justify your ranking a little bit more. So you said, yeah, it's pretty important, 7.5 out of 10. This is my reason why. We didn't hear much else about it. So maybe it'd be worth kind of talking a little bit about, as well as it being important to learn about the relationships from the doctor and understanding the reasoning behind it, which is obviously your driving, force by wanting to speak to this doctor and what you wanted to get out of it, which is awesome. Maybe it's also worth considering the reasons it might not be that great to speak to the physician, reasons why it might not be that important as well. And there might not be many of them, but it's always important, to consider both sides of the argument before you make your definitive decision. You don't want to sound too on the fence, but it is important to consider both of these arguments and then go, but overall, I feel like this is, led me to rank it this out of 10, or this as being the most reasonable response that I'd be comfortable with, given that I've considered both of these kind of extremes.
Okay, yeah.
Cool. All right. So I think question 3 is probably my favourite of these questions, talking about the risks and long-term implications of speaking to Dr. Carey. And I think this is kind of where it's a good one, in that we're obviously looking at problem-solving skills here, but also the impacts of your decisions. I think it's also a skill that we can definitely apply to many ethical situations here, and that we've got to consider, what are the impacts of our decisions? It's not just do we have a Vegemite or a jam sandwich today? There's actually going to be long-term effects, and there are going to be implications. And some of them might not seem that significant, but it's important that we do consider them before we do make decisions, particularly when you're going to speak up to a higher authority figure. That's something we're definitely going to be faced with moving forward. So making sure we're aware of that. And you definitely covered the risk of having a poor evaluation. And I think my favourite was one of your last comments in this section about you saying how I'm not sure of the repercussions or how significant this peer evaluation is. I think that's a really important point. Maybe just elaborate a little bit further on that, in that, will that change your response? If it's something that's really, a really big part of your grade, is it going to be something that determines whether you pass or fail? Will that change your response and your willingness to speak to the doctor, versus if it was something that's only worth 10% of your grade, it might not have as much of an impact.
Yeah, that's a good point.
It might not necessarily, because I think that's the point you were kind of getting at, but kind of just draw it out that little bit further, really explain, like, why does the repercussions of this, I suppose, evaluation, why are they important, and why is that going to have a difference in the implications? And I think the other one for this one as well is that we've got to consider what is the implications, not just to you, but to everybody else, I suppose, in this situation. So we've been spoken to here about, we have Dr. Carey, we have our resident as well. Our nurse is obviously a big part of this as well. But there's also lots of other staff, there's patients, there's visitors, there's lots of other people in this environment that we also kind of need to have some awareness of how it may impact them. So the main impact is obviously going to be on you, and thinking about this poor evaluation and your progression as a medical student, your education and your ability to become a good doctor. That's definitely going to be a big concern there. But also considering what's going to happen to Dr. Carey and the resident. Will they go, oh, I'm so sorry, that was, not appropriate? Will they feel humiliated and then be less likely to take on board your feedback? What about the nurse? Are they going to hear the long way around that they've had doctors speaking poorly about them, and what effects that's going to have on their job and how people perceive and trust them? So that's something to keep in consideration, as well as the patient. We want to make sure the patient, because obviously they're also kind of on the back burner of this situation, because this conversation and these condescending comments are being made, I suppose, behind closed doors, away from them. But what is the relationship of this, multidisciplinary team? What is the relationship and the communication between our nurses, our medical students, our doctors? How does their interaction and the way they work together then go on to impact our patient? So it's really good, and I love that you started with yourself. That's the most important one, definitely, particularly in this situation, because we're not directly dealing with the patient here. But there's lots of different people that we can consider, and we don't have to spend long considering them in lots of depth, but maybe just work on showing, this is my main point, this is the main long-term outcome, the main risk of this, speaking to Dr. Carey. But these are some other areas that I may need to consider, as they will also have some implications for certain people.
Okay, cool. Yeah, that's so helpful.
And the last question here, we're looking at, how does your decision contribute to your overall professional development? I think this is something you kind of covered throughout all of your questions, which is totally fine, because you don't know what the question is coming at the end here, and how you're talking about how it's really about learning. It's an environment in which we need to be constantly learning and adapting in order to become the best doctors and the best healthcare professionals that we can be. There's one phrase that I actually wrote down here as you were speaking, something about how I have repeatedly mentioned, and that's totally fine if you have mentioned something before, but rather than phrasing it as, I have repeatedly mentioned this, maybe just phrase it as discussed earlier, or in a way that you allude to that you've already discussed it, so it doesn't seem like you're babbling on or that you're repeating yourself too often. But also make sure that you are saying, this is my main point, this is really relevant to this question, and the examiner will then go, she's already spoken about this, that's really good. I can see that this person is reflecting on how that's a really good response and how that's going to help in your professional development. So I know that was a lot of overall, but I just want to say, overall you spoke really, really well, and that's something that came across really well. I suppose a lot of my critiques were more so on the content, and it doesn't have to all be there. I think that's the beauty of medical interviews, is that you don't have to say everything. They want to see your thought process and see that you are considering things more widely. You don't have to include everything. I just had one thing. I suppose I've kind of mentioned it a little bit earlier when we were talking about the risk and long-term implications, but I would say my biggest bit of advice to you would come up with some kind of, not so much a structure because you don't want it to be too robotic, but come up with some kind of model in which you can consider everything. So I know for me personally, whenever I attempted, for me it was particularly with ethics situations, I would think about myself, I would think about my patient, I would think about all the different people involved. And that was my approach and my answer. I would start with me, then I would talk about everyone else, and I would consider each of them. Or you could start with, what is the most immediate impact of this decision? Then what's a medium-term impact and a long-term impact? So have some kind of way where you can really consider everything more broadly, and then you can really bring into that greater amount of consideration in there, because I can see you're really thinking about the situation. Just got to make sure that it comes across really well.
Yeah, no, that's so true. Now that you said all that, I'm like, wow, that was such a self-centered answer, but
Yeah, I think I really do need to consider everything a bit more.
Yeah, it's definitely something that comes with a bit of practice, but you do have to remember that you in this place are the most important person. As healthcare professionals, we're like, yeah, we always put the patient first, and that is true. But at the same time, you need to consider your own safety and not putting yourself in harm's way. That is always going to be your number one. And this situation, I suppose, is not so much about safety or anything too dire as the risk of the consequences, but you definitely need to make sure that you are looking out for yourself.
Yeah, no, that was all so helpful, all that advice. Thank you so much, Keeley.
That was definitely a hard situation to tackle with lots to consider. If you're also a student like Anastasia preparing for your med interview soon and want that level of detailed feedback from examiners like Keeley, I'll leave a link to our mock MMI rounds in the show notes below. And make sure you continue listening to the rest of this season as there are more of these open source stations to come. So we'll see you on the next one.